Surgeons of Reddit, what has been your biggest oh crap moment? Way back in the day pre-op was done with alcohol-based cleaners. Naked, sedated guy with a light sheen of cleaning fluid on him and static electric spark equals fully engulfed in flames. Everyone just stood there for a second till someone grabbed a sheet and put out the flames. Surgery went well, no complications, slight suntan. Balboa Navy Medical Center, San Diego, old surgeon. This one's from my dad. We were putting up a central line for a drip with an 18G needle, 1.2 mm relatively big compared to most needles, in the patient's external jugular, and all of a sudden the needle went right into the jugular. We all started panicking because usually with a drip the needle is meant to come out and only the plastic remains. But now we had lost the needle inside this guy's jugular. Before we could even fish it out it was gone. I looked at the fellow surgeons and nurses and before we could do anything we rushed him right into theater. After a few minutes we fished the needle out near his subclavian vein closer towards the shoulder and we breathed a sigh of relief. Oh god. I wasn't present for this, but I got to deal with the fallout. Client brings his cat, found as a stray, to be spayed. The vet, my boss, preps cat for surgery and begins cutting, and can't find the uterus or ovaries. Oh, cat is a male, and poor kitty just had his belly sliced open for no reason whatsoever. The owner was, understandably, furious. I was a junior doctor working in neurosurgery back in 2008 when one of the senior registrars, I suppose the equivalent is chief resident in the USA, told me his most unfortunate moment. In order to have a patient's head stabilized for surgery he was using a frame that had a set of 3 spikes that held the head in place. Due to the angle he needed to approach from, this required the patient to be face down. As he was placing the head of the anesthetized patient onto the frame the head slipped and his eye landed onto the spike, perforating the eyeball. Panicking and thinking that his career was now over, he then, rather busily, started poking at the eyeball trying to work out what was what until the anesthetist told him to stop. They then called the ophthalmologist who came to tidy up what was now a completely ruined eye. After the surgery, terrified, he went to explain to the patient what had happened. Understandably fearing the worst, anger, distress and tears, received the response of "That's okay, I was blind in that eye anyway. Luckiest bastard ever." TLDR. Surgeon perforates patient's eye by mistake. Patient doesn't care. No fricking way. I woke up during the last part of my gallbladder removal. I felt this pressure, as my surgeon had him for a prior operation. Funny guy, was trying to close one of the wounds. I lifted my head, we locked eyes and he had this startled "oh frick, look." Then he snapped back to normal, said "patient's up," and the anesthetist was on that crap. Woke up an hour later in recovery. Props on both of them for sure for handling it properly. Anesthesiology is an inexact science and mistakes happen. Hopefully it didn't frick with you too bad. I'd probably crap all over the table in fear. Had a friend with a swollen area on his lower back where it got to the point where he could barely sit. So he goes to his family doctor. The doc says "Yay, that's a pilonidal cyst. We should probably go ahead and take care of that." He told my friend to take off his shirt and lay flat on his stomach. So he's laying there and waiting and the doctor says "You're going to feel a poke," and is at this point expecting a local. Well, first it turns out the poke was actually a scalpel, not a local. He said it basically felt like someone took a fire hot poker and drove it into his back. He then hears the doctor exclaim, "Oh boy, we have a pumper," just as he feels warm blood and pus now pouring all over his back. The nurse's face, which was the only thing he could see, went from a warm smile to what he termed as pure and unadulterated fear, as the doctor is screaming for her to get gauze and towels. The doctor climbed up and laid on his back to apply pressure for about 10 minutes until the bleeding stopped. So yay, I'm hoping I never get one of those. Worked in an OR for a couple years as a biomedical engineer. Sprinted to the room when equipment wasn't working right, or, more often, the surgeon or anesthesiologist didn't know how to use the equipment. This happened so much. With about 70 ORs this was a fun day. 1. A surgical table was malfunctioning going into full Trendelberg. Table tilts to a serious angle, was tilting on its own and patient was sliding off the table. The whole surgical team was holding onto the patient as I run in. The fix was I slammed the controller against the floor a few times. Patient was okay, but blood everywhere. 2. A resident was putting in a trocher and misplaced it. Sliced open the aorta. 12 hours of surgery to repair. She was going in for a simple procedure. 3. Surgical robot froze in a case. Had to reboot, but the arm was grasping a main blood vessel. So we didn't want to reboot for fear the arms would rehome and let go of the vessel. Also, we lost video when it froze, so we couldn't just retract the instruments. Lots of people saying oh crap, I am the one pushing the power switch, so if it tears out someone's organs they all look at me. 4. Brain surgery. Microscope video feed crashed. I was trying different video connections to get the overhead monitors back up, but every time I accidentally hit the scope with my hand, causing vibrations that were pretty magnified while working in the brain. He told me to never mind and to get the frick out. This was my first day, so it's okay. Many more. Ours are a scary place, but fun and exciting job for sure. Rewarding to save the day while a team of surgeons, nurses, PAs all thanking you profusely. I will never, ever go to a doctor again. Ever. Not quite a surgeon, but somewhat medical. I was bisecting someone's leg, deceased, and I did not know that said person had a metal rod through their femur. Proceed to cut through the bone with a metal saw. Sparks fly and my blade broke. Luckily I was standing off to the side, instead of directly behind the bleed, as it flew backwards and hit the wall. The clothes the person had been wearing were lying underneath the body and caught a spark. I doused it with the water hose before a large flame could start, but still an oh crap moment. I doubt you'll get too many real stories. Mine is extremely rare, as I was the patient, but awake for the surgery. I was supposed to have a bump on my back removed. Nothing huge, just a lump of some kind. For insurance reasons they did it as an ambulatory in the OR of a hospital instead of the surgeon's actual office. So, I'm wide awake, face down in the OR. I had picked him as my surgeon because his main practice was plastic surgery. At the time I lifted weights a lot and spent a lot of time working my back. I wanted as small a scar as possible. I was vain. He begins with the first incision, then goes for a second, larger, then goes deeper, I guess, and realizes the bump is just the extruding tip of a cyst that cut through my back to the back of my lungs. He wasn't used to operating on alert patients. As soon as he realizes, he just says, "Oh frick." That was the beginning of a 4-hour surgery for which I was awake. What they cut out of me was the size of an adult fist. In closing the wound they drew in so much flesh, for lack of a better word because of my lack of medical understanding, that my right arm became essentially inflexible. I couldn't lift weights for years. All that precious work shot down the drain. What an butthole I was. As someone who has a small bump on my back that I've been putting off getting checked out, this story is terrifying. My first C-section was quite the shocker, but after that not a lot faced me anymore. This event occurred during one of my internships as a high schooler to see if medicine would be my field. Why? I'm not sure, but they let me attend a C-section. They placed me at the feet of the woman that was numb, chest down. I give her a little nod and the operation starts. Well, no one had thought to tell me that once the belly is cut, the liquids go out too. This is the logical thing. But I was seated at least 3 meters from the feet of said woman and the fluids gushing from her abdomen came all the way to my feet. Here is me, standing in a woman's pregnancy fluids. Oh, frick. I must have looked very shocked because the other surgeons had a laugh about my reaction. Ever since, I've not been shocked once. I dropped my phone in a puddle of amniotic fluid after I scrubbed out of a cesarean. I was rounding a few months back and a guy gets wheeled into ICU smelling terrible. I walked over, and the dude had maybe the most macerated legs I have ever seen. There were things moving on the bed, and the suction container was full of maggots. Turns out dude had been weaving on the road, and when police pulled him over and opened the doors, maggots fell onto the road. He got taken to the arrested, taken up to ICU and very rapidly debrided, then bilateral above knee amputated. He actually made it out of the hospital, but I cannot imagine waking up one day and having no legs. I really wish I knew where he was driving, though. The medical stuff really becomes a blur. Complications, bad outcomes, crazy patients. I dunno, but after a few years even the bad stuff just becomes part of the routine. But there was one moment that still sticks with me from training. I was called into a meeting with the program director, which is never a good thing, and I wasn't entirely sure why. He makes some small talk, then start asking about one of the junior residents who had been on my service. Definitely one of the weaker residents, but hardworking and likable. I start talking about her performance and her relationship with the other residents, her strengths and weaknesses, etc. After a minute I came to the horrible realization he wasn't just asking about her, he was gathering ammunition to fire her and I was part of the firing squad. I jammed on the brakes and tried to talk her up, talking about her work ethic and how well she got along with the nurses in the team. But we both knew it was a done deal before I sat down. I don't know why it bothered me so much, compared to kids who burn to death and the like. But that sudden realization while I was sitting there that someone I kinda liked personally, who had spent most of their adult life struggling in undergrad, medical school, and the lab, who had what I suspect was 6-figure debt, was about to get their career destroyed just stunned me. I don't know if she was going to be an unsafe doctor. I think the fact we liked her allowed her to slide further than she should have, in retrospect. But of all the terrible things that happened in residency, that's the one I think about most often. Nurse here. I was assisting with a simple vasectomy and the doctor was having trouble differentiating the vas deferens from the testicular artery. I stopped him just before he cut the artery. If he cut that, the testicle would die, not to mention make a very bloody mess. Not a surgeon, but I was observing a hand surgery about a year ago at a teaching hospital. The surgeon was removing one of the carpals, the bones near the base of the hand, to be used later. A nurse was given the carpal to hold until it needed to be used. She ended up dropping the patient's bone on the ground. I broke my wrist once, and the broken bone had to be surgically adjusted so it would grow to be a nice and functioning one again. It appeared to be an easy and uncomplicated procedure, and 2 hours later I woke up with a cast around my arm being told everything went fine. A couple of weeks later I returned to the surgeon who performed the surgery to have the cast removed. As soon as he took it off he had a confused look on his face. I could see him think shit, and he told me perhaps it didn't go exactly as planned. The two parts of the bone weren't placed in a straight line during surgery, so after a couple of weeks in a cast my arm was now really funny looking and crooked. Arm had to be manually broken again and put in a bit more of a straight position. Few weeks and a wicked looking scar later everything was okay again. Not a surgeon, but I'm a med school student. A student 2 years older than me dropped a brain tumor on the floor on the first surgery he ever went on. The surgeon laughed at him, then told him to leave his operation room. He was devastated and never saw that surgeon again, but he still got a good evaluation for that rotation. At least it was a tumor and not something they planned on putting back in. When I was a medic, I worked in the one night and this huge dude, maybe 350 lbs, came in from a car accident with the paramedics giving him CPR. We got to doing our job when it was decided that he would have to go to the OR as he eventually went asystole, flatlined. I was new and my knowledge was pretty limited at the time, but I believe they were going to massage this guy's heart. I was pretty relieved since we were all taking turns pumping this big butt man's blood for him and we were beat. Shortly after he left I was talking to some of the medics docs and they said that it would be a great experience for me to watch it in the OR room. So I scrubbed up really quick and went in to watch in the back and they were already about to start cutting this guy open. I watched in excitement as they were cutting through everything when suddenly, blood burst out of this guy like a pot boiling over. There was more blood than I have ever seen, and hopefully will never see again. I don't remember anyone saying oh crap, but I remember everyone getting really quiet, the staff stepping back as the blood flowed out of him, on the table, falling on the floor and crept until it got a couple feet away from me. I was like 6-8 feet away. Most of them were standing in the lake of blood when it stopped. The surgeon said that it looked like at least 3 liters of blood that came out of him. They hadn't seen that much blood come out at once either. It looked like some kind of Japanese horror scene afterwards and I think I was in shock because I felt so weird and out of place afterwards, watching them so clean him back up. Later on, I ended up finding out that upon a closer look to the x-rays it showed that the man's poor sternum gave way either from his chest hitting the steering wheel, he had no seat belt on, the firefighters, paramedics or our CPR. The bone had splintered and punctured into his major vessels, aorta, pulmonary vein artery, so we were pumping blood into his pericardium, heart sac, and that was what exploded when they cut him open. So there was little we could do to save this man's life. After that episode I never was bothered by the sight of massive blood loss, since I don't think you could see any more than that come out of a person. TLDR. Blood. So much blood. Oh. TLDR. Wear your seatbelts. I was the patient, not the doctor, but the doctor in charge of the surgery I went through in 2008. 22 hours, 3 doctors and 55 units of blood. Said that if I'd been 5 years older and he'd seen what he did upon opening me up, he'd have closed me up, sent me home and told me to enjoy the rest of my time. It was sobering to eventually hear that. Since I'm guessing there aren't too many surgeons on Reddit during the middle of a Monday, I'll throw in what I have. Surgical nurse here. I was an OR nurse for a very short time in between 2 jobs in hospital surgical units taking care of post-op points. Right now I'm in a surgical step-down unit, which means really sick post-op points who aren't quite sick enough for the ICU, but could still start tanking any minute. Most of our oh crap moments are pretty boring, like oh crap, they found more cancer. Oh crap, his oxygen percentage is going down. Oh crap, there's a mucus plug obstructing her airway. Things like that. In the OR, the worst I saw was some shithead optometrist who thought spending 5 minutes per patient was a good way to do cataract surgeries. Most surgeons spend about 15-25 minutes per surgery. At one point he told me to keep the pre and post-op eye drops uncapped, because he didn't want to have to wait the literal 5 seconds it took me to unscrew the caps after each surgery. The patient's eyes looked all mangled and misshapen after the surgery, whereas every other cataract surgery I've ever seen, the points look fine right afterwards. Not really an oh crap moment, but I told my boss after that day that I never wanted to work with that guy again. It was an accident waiting to happen. I heard one of his patients got an infection and lost their eye, but most of them were fine. Still, I wouldn't have let him watch my goldfish for a week-long vacation, let alone come at my eye with a knife. He was a doucher nozzle. And this is how ophthalmologists got that reputation. My mom had gone in for surgery. Because the hospital didn't have what they needed, they had to have an essential part for the surgery shipped to them. The day comes for the surgery and my mom is prepped. The OR is prepped. The surgeon took the day off from his practice, and my mom is put under. The part they needed, a fluid I believe, arrived and a nurse said, "We never ordered that," and sent the guy away. This is after my mom was under anesthesia. She said when she was being brought out of it she could see the surgeon losing his crap on these nurses and all them crying from how bad he flipping out on them. Rightfully so. Those nurses at that hospital suck. The surgery was moved elsewhere and that was the last time he worked with that hospital. I wasn't the surgeon involved in the case, but a patient had a bump on his leg. After imaging, it looked like it was an abscess collection that needed drainage. The patient was taken to the OR and the subcutaneous tissue dissected off. All of a sudden blood starts squirting. Turns out the abscess was really a femoral artery aneurysm. Overhead stat called for the vascular surgeon to bail him out. Story from my vet. He was in a super rundown barn with a pregnant mare in trouble. She'd been getting up, lying down, and getting up again, but nothing was happening. Horse births are heck on earth. His words. Because the foal doesn't turn until minutes before birth is supposed to happen. And if they're in the wrong position it's nothing in there but rigid legs and sharp little hooves, and good luck getting that repositioned with 1,000 pounds of frightened horse flesh and pain on your arm. So there he is, at night, up to his elbow in this frightened mare. She's not really into what's going on and doesn't want to stand for it. He's not terribly fleet of foot in that position, so it's up to the owner at her head to keep her calm, and that person is doing the best she can. Keep in mind this barn is in horrible shape. Really, just a dilapidated health hazard. Well, the mare decided she'd had enough and tried to walk through the owner. I'm guessing there was a stud chain involved, a metal chain that loops around the nose, jaw, over the gums, or however you want to attach it so that you have more persuasive power over the horse. The owner was shoved off balance and managed to grab a live, uncovered wire. Why there was one in a barn I will never understand, but the result was that current flowed through her to the horse and into my vet. So now the poor guy is elbow deep in a terrified mare while both of them and the owner are being electrocuted. He didn't tell us how he got out of that, but the mare was okay and she delivered a live foal. They named the filly Electra, and that was when I first began to think maybe I didn't want to be a horse vet after all. Man, I thought this was going to end up with the arm being smashed by electrically induced cramping or something. Glad there was a happy ending there, but man, that sounds pretty fricked up. Dr. Nick, singing, the knee bone's connected to the something. The something's connected to the red thing. The red thing's connected to my wristwatch. Oh. If I kill you, you don't pay. Mine isn't as gruesome as some of these, but I figure I can share. I have several herniated discs, pinched nerve, spinal spondylosis, etc etc. Went in for a major epidural. Most people get one too, but I was getting 6. Basically, they put you under, fit a needle in between your discs and give you a shot. Well, it might have been due to the fact that I was taking some heavy dosages of narcotics already, but I woke up on the table. It was kind of hazy, but I was definitely aware. I could feel a slightly burning fuzzy feeling in my back. It felt like butterflies when your leg goes asleep and there is something scraping near on or on my bones feeling. I could see a screen with a live X-ray looking thing. I found out the surgeon watches the screen to guide the needle. Just as I could feel like I may be able to raise my head, I came to the realization one of the nurses kept repeating, "He's awake, not too panicky, but definitely, like oh crap." I wanted to tell her to relax, but by then someone walked up to one of the IVs and I was back to sleep. All in all, it was a win. I threw a fit about how good the fruit juice was, so they gave me the whole container, and I tried to fight the nurses trying to dress me, because my girlfriend was waiting outside on me. She thought it was cute, so she obliged and brought me to Wendy's per my request. I then ordered over $20 of food, got home, and ate none of it. Good times. This is less oh crap scary, and more oh crap. As a medical student, I got to assist in the repair of a vaginal anal fistula. Basically a connection between the two that meant the poor patient was leaking crap out of her vagina. Given the nature of the operation, the operating room smelled so horrific the anesthetist actually had to leave because they were dry heaving so much. Towards the end of the operation, we had to flush out the remains of the colon, and so I flushed saline through whilst the consultant surgeon stood at the end of the table with a bin bag. Once we were done, the surgeon looked at me with a totally defeated look in his eyes, up to his elbows in crap, and said, "I have a really freaking glamorous job." So that is my oh crap moment. A shiny upvote to you for literalism. This happened to me while placing an IVC filter, a small metal filter that sits in the inferior vena cava to prevent blood clots from traveling from the legs to the lungs. The procedure basically includes tunneling into the femoral vein and traveling up into the vena cava, where you leave the filter in place. In order to confirm your location in the body, you have to use a radiolucent contrast and an X-ray to light up the vena cava, since you are basically looking from outside of the body. The scrub tech hands us 100 cc of contrast and we inject it straight into the vena cava and watch on the X-ray while nothing lights up as it's supposed to. Not able to figure out why we couldn't see it, we ask for another 100 cc of contrast and again shoot it into the vena cava with no luck. At a loss as to what could be going on, we think maybe that the contrast is bad and we draw up some more and look at the syringe under the X-ray before injecting this time. Of course the syringe does not light up, and while we are trying to get some new contrast in the patient on the table, who is sedated and intubated, begins to seize. We finally look over at the scrub tech's table and realize what she has done, and turns out she was drawing up 100 cc, twice mind you, of lidocaine, a quick acting anesthetic which is not supposed to be injected directly into the central circulation of the body. Luckily the patient was not permanently harmed due to this medical error, but I was working with a very senior vascular surgeon at the time and I've never seen her look the slightest bit fazed by anything she's seen, but when she realized we gave the patient that much lidocaine, she looked like she was about to faint. TLDR. Injected 200 cc of lidocaine straight into the heart thinking it was contrast and caused a patient to have a seizure. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.